Welcome to our comprehensive guide on high-yield topics in adult health for the NCLEX examination. Whether you're preparing for your first attempt or looking to boost your confidence, understanding which topics are most frequently tested can make a huge difference. In this video, we'll break down the essential areas you need to focus on, provide practical tips, and help you prioritize your study time. Let's dive into the key concepts that will help you ace the NCLEX and become a confident registered nurse. Cardiovascular disorders are among the most tested topics in the adult health section of the NCLEX. You'll need to be familiar with conditions like hypertension, heart failure, myocardial infarction, and arrhythmias. Understanding the pathophysiology, common signs and symptoms, nursing interventions, and patient education points for each disorder is crucial. Pay special attention to medication management and monitoring for complications, as these are frequently included in exam questions. Hypertension is a chronic condition that affects millions and is a leading cause of complications like stroke and heart attack. For the NCLEX, focus on the risk factors such as obesity and smoking and the importance of lifestyle modifications. Know the classes of antihypertensive medications, their side effects, and nursing considerations. Be prepared to answer questions about patient education, especially regarding adherence to medication and dietary changes. Heart failure is another high-yield topic. You should understand the difference between left-sided and right-sided heart failure, their symptoms, and the nursing interventions required for each. Monitoring fluid balance, daily weights, and recognizing signs of worsening heart failure are key. Also, be familiar with medications like diuretics and ACE inhibitors, and the importance of patient education on sodium restriction and fluid management. Myocardial infarction or heart attack is a critical emergency that you must be prepared to manage. Recognize classic symptoms like chest pain, shortness of breath, and diaphoresis. Immediate interventions include administering oxygen, nitroglycerin, aspirin, and morphine as ordered. Know the importance of rapid response and monitoring for complications such as arrhythmias. Patient education on lifestyle changes post-ME is also frequently tested. Arrhythmias are irregular heart rhythms that can be life-threatening. For the NCLEX, you should be able to identify common arrhythmias on an ECG strip, such as atrial fibrillation, ventricular tachycardia, and bradycardia. Know the nursing interventions for each, including medication administration and when to notify the healthcare provider. Understanding the basics of ECG interpretation is a valuable skill for both the exam and clinical practice. Respiratory disorders are another cornerstone of adult health on the NCLEX. Focus on conditions like chronic obstructive pulmonary disease, COPD, asthma, pneumonia, and pulmonary embolism. Understanding the pathophysiology assessment findings and priority interventions for each disorder is essential. Pay attention to oxygen therapy, medication management, and patient education, as these are common areas for exam questions. COPD and asthma are chronic respiratory conditions with overlapping but distinct management strategies. For COPD, focus on smoking cessation, breathing exercises, and medication adherence. Asthma management centers on identifying triggers, using inhalers correctly, and monitoring peak flow. Be prepared to answer questions about acute exacerbations, oxygen delivery, and patient education for both conditions. Pneumonia and pulmonary embolism are acute respiratory conditions that require prompt recognition and intervention. For pneumonia, focus on assessment findings like fever, cough, and crackles, as well as antibiotic therapy and respiratory support. Pulmonary embolism presents with sudden shortness of breath and chest pain. Know the risk factors, diagnostic tests, and emergency interventions, such as anticoagulation and oxygen therapy. Diabetes mellitus is a high-yield endocrine disorder on the NCLEX. Focus on the differences between type 1 and type 2 diabetes, common complications, and the importance of blood glucose monitoring. Know the signs of hypoglycemia and hyperglycemia, and the appropriate nursing interventions for each. Patient education on insulin administration, diet, and lifestyle modifications is frequently tested. Recognizing and managing hypoglycemia and hyperglycemia is vital for patient safety. Hypoglycemia presents with symptoms like shakiness, confusion, and sweating, while hyperglycemia may cause increased thirst and urination. Know the immediate interventions for each, such as administering glucose for hypoglycemia and insulin for hyperglycemia. Patient education on recognizing early signs and preventing complications is key. Diabetic ketoacidosis is a life-threatening complication of diabetes, most commonly seen in type 1 diabetes. Key features include high blood glucose, ketones in the urine, and metabolic acidosis. For the NCLEX, focus on the assessment findings, priority interventions like fluid resuscitation and insulin therapy, and monitoring for complications such as hypokalemia. Early recognition and prompt treatment are crucial for positive outcome. Renal disorders, such as acute kidney injury and chronic kidney disease, are important topics in adult health. Understand the causes, assessment findings, and nursing interventions for each. Pay attention to fluid and electrolyte management, monitoring for complications, and patient education on dietary restrictions. The NCLEX often tests your ability to prioritize care for patients with renal impairment. Acute kidney injury is characterized by a sudden decline in renal function, often due to dehydration, medications, or sepsis. For the NCLEX, know the risk factors, assessment findings like decreased urine output, and interventions such as fluid management and monitoring for electrolyte imbalances. Early identification and prompt intervention can prevent further complications and improve patient outcomes. Chronic kidney disease is a progressive loss of renal function over time. For the NCLEX, focus on the stages of CKD, common complications like anemia and bone disease, and the importance of dietary restrictions. Know the nursing interventions for managing fluid overload, electrolyte imbalances, and patient education on medication adherence and dialysis preparation if needed. Electrolyte imbalances such as hyperkalemia, hypokalemia, hypernatremia, and hyponatremia are frequently tested on the NCLEX. Know the normal ranges, causes, signs, and symptoms, and nursing interventions for each imbalance. Be prepared to prioritize care for patients at risk of life-threatening complications, such as cardiac arrhythmias with potassium disturbances. Gastrointestinal disorders, including peptic ulcer disease, gastrointestinal bleeding, and liver cirrhosis, are important adult health topics. Focus on assessment findings, priority interventions, and patient education. Know the signs of GI bleeding, such as black tarry stools, and the emergency interventions required. For liver disease, understand the complications like ascites and hepatic encephalopathy, and the nursing care involved. Peptic ulcer disease is characterized by sores in the stomach or duodenum lining. For the NCLEX, know the risk factors such as NSAID use and H. pylori infection and the classic symptoms like epigastric pain. Nursing interventions include medication management, monitoring for complications like perforation, and patient education on avoiding irritants like alcohol and spicy foods. Gastrointestinal bleeding can be life-threatening and requires immediate intervention. Recognize signs such as hematemesis, melena, and hypotension. For the NCLEX, focus on priority interventions like establishing IV access, monitoring vital signs, and preparing for possible blood transfusion. Patient education on preventing recurrence, such as avoiding NSAIDs, is also important. Liver cirrhosis is a chronic condition with serious complications like ascites, hepatic encephalopathy, and variceal bleeding. For the NCLEX, understand the assessment findings, such as jaundice and abdominal distension, and the priority interventions for each complication. Patient education on avoiding alcohol and adhering to dietary restrictions is crucial for long-term management. Neurological disorders such as stroke, seizures, and increased intracranial pressure are high-yield topics for the NCLEX. Focus on recognizing early warning signs, priority interventions, and patient safety measures. Know the differences between ischemic and hemorrhagic stroke and the emergency management for each. Seizure precautions and postictal care are also frequently tested. Stroke is a medical emergency that requires rapid recognition and intervention. For the NCLEX, know the classic signs of stroke, such as facial droop, arm weakness, and speech difficulties. Priority interventions include maintaining airway, breathing, and circulation, and preparing for possible thrombolytic therapy. Patient education on stroke prevention and rehabilitation is also important. Seizure management is a critical skill for nurses. For the NCLEX, focus on the types of seizures, safety precautions during a seizure, and postictal care. Know the importance of protecting the patient from injury, maintaining airway, and documenting the event. Patient education on medication adherence and seizure triggers is also frequently tested. Increased intracranial pressure is a life-threatening condition that requires immediate intervention. For the NCLEX, recognize signs such as altered level of consciousness, headache, and vomiting. Priority interventions include elevating the head of the bed, monitoring neurological status, and avoiding activities that increase ICP. Early recognition and prompt action can prevent serious complications. Musculoskeletal disorders such as fractures, osteoporosis, and arthritis are common in adult health. For the NCLEX, focus on assessment findings, priority interventions, and patient education. Know the signs of compartment syndrome, the importance of immobilization, and strategies for pain management. Patient education on fall prevention and medication adherence is also important. Fractures require prompt assessment and intervention to prevent complications. For the NCLEX, know the signs of compartment syndrome, such as severe pain and decreased pulses, and the emergency interventions required. Immobilization, pain management, and monitoring for neurovascular compromise are key nursing responsibilities. Patient education on CAS care and signs of complications is also important. Osteoporosis and arthritis are chronic musculoskeletal conditions that affect mobility and quality of life. For the NCLEX, focus on risk factors, assessment findings, and nursing interventions. Patient education on fall prevention, medication adherence, and lifestyle modifications is crucial. Know the differences between osteoarthritis and rheumatoid arthritis and the specific care required for each. Infectious diseases such as tuberculosis, HIV/AIDS, and sepsis are high-yield topics for the NCLEX. Focus on modes of transmission, assessment findings, and priority interventions. Know the importance of infection control measures, medication adherence, and patient education on preventing the spread of infection. Early recognition and prompt intervention are key to improving outcomes. Tuberculosis is a contagious disease that requires strict infection control measures. For the NCLEX, know the signs and symptoms such as cough and night sweats and the importance of airborne precautions. Patient education on medication adherence and preventing transmission is crucial. Monitoring for side effects of TB medications is also frequently tested. HIV/AIDS is a chronic infectious disease that requires comprehensive nursing care. For the NCLEX, focus on modes of transmission, assessment findings, and priority interventions. Patient education on medication adherence, infection prevention, and psychosocial support is crucial. Know the signs of opportunistic infections and the importance of regular monitoring. Sepsis is a life-threatening response to infection that can lead to septic shock. For the NCLEX, recognize early signs such as fever, tachycardia, and hypotension. Priority interventions include obtaining blood cultures, administering antibiotics, and supporting blood pressure. Early recognition and prompt intervention are critical to improving patient outcomes. Oncology nursing involves caring for patients with cancer. For the NCLEX, focus on common cancers, assessment findings, and priority interventions. Know the side effects of chemotherapy and radiation and the importance of infection prevention. Patient education on managing side effects and psychosocial support is also frequently tested. Chemotherapy and radiation are common cancer treatments with significant side effects. For the NCLEX, know the common side effects such as nausea, fatigue, and immunosuppression. Nursing interventions include managing symptoms, preventing infection, and providing emotional support. Patient education on self-care during treatment is crucial for positive outcomes. Hematologic disorders such as anemia, sickle cell disease, and clotting disorders are important adult health topics. For the NCLEX, focus on assessment findings, priority interventions, and patient education. Know the signs of anemia, the management of sickle cell crises, and the importance of preventing complications in clotting disorders. Anemia and sickle cell disease are hematologic conditions with unique management strategies. For the NCLEX, know the causes, assessment findings, and nursing interventions for each. Patient education on dietary modifications for anemia and pain management for sickle cell crises is crucial. Monitoring for complications and providing emotional support are also important aspects of care. Clotting disorders such as hemophilia and deep vein thrombosis (DVT) require careful management. For the NCLEX, focus on assessment findings, priority interventions, and patient education. Know the signs of bleeding, the importance of avoiding injury, and the use of anticoagulant medications. Patient education on recognizing early signs of complications is key. Endocrine disorders such as thyroid disease and adrenal insufficiency are high-yield topics for the NCLEX. Focus on assessment findings, priority interventions, and patient education. Know the differences between hypothyroidism and hyperthyroidism and the emergency management of adrenal crisis. Patient education on medication adherence and monitoring for complications is also important. Thyroid disorders, including hypothyroidism and hyperthyroidism, have distinct assessment findings and management strategies. For the NCLEX, know the classic symptoms, medication management, and patient education. Recognize the signs of thyroid storm and myxedema coma and the emergency interventions required for each. Patient education on medication adherence and monitoring for complications is key. Adrenal insufficiency or Addison's disease can lead to life-threatening adrenal crisis. For the NCLEX, know the assessment findings such as hypotension and hyperpigmentation and the emergency interventions required. Patient education on medication adherence and recognizing early signs of crisis is crucial for preventing complications. Immune system disorders such as lupus and rheumatoid arthritis are important adult health topics. For the NCLEX, focus on assessment findings, priority interventions, and patient education. Know the signs of flare-ups, the importance of medication adherence, and strategies for managing symptoms. Patient education on infection prevention is also crucial. Lupus and rheumatoid arthritis are autoimmune disorders with unique management needs. For the NCLEX, know the assessment findings, medication management, and patient education for each. Recognize the signs of flare-ups and the importance of infection prevention. Patient education on medication adherence and lifestyle modifications is also important. Maintaining fluid and electrolyte balance is a fundamental aspect of adult health nursing. For the NCLEX, know the normal ranges, assessment findings, and nursing interventions for common imbalances. Be prepared to prioritize care for patients at risk of complications, such as cardiac arrhythmias or seizures. Patient education on dietary modifications and monitoring is also important. Pain management is a key component of adult health nursing. For the NCLEX, focus on assessment, medication management, and non-pharmacologic interventions. Know the differences between acute and chronic pain and the importance of individualized care. Patient education on pain management strategies and medication safety is also frequently tested. Patient safety and prioritization are essential skills for the NCLEX in clinical practice. Focus on recognizing safety hazards, implementing fall prevention strategies, and prioritizing care based on patient needs. Know the principles of delegation and teamwork and how to respond to emergencies. Patient education on safety measures is also important. We've covered the most high-yield topics in adult health for the NCLEX examination. By focusing your study on these areas, you'll be well prepared to tackle the exam with confidence. Remember to review key concepts, practice NCLEX-style questions, and prioritize patient safety in every scenario. Good luck on your journey to becoming a registered nurse. You've got this.